Mrs. J is a 39-year-old female who presents to the hospital due to worsening fatigue, rash, and low-grade fever. Her rash is located on her face. Her B&B shows elevated creatinine at 3.5. Baseline is 0.9, so that's her creatinine normal is usually 0.9, but today it's for some reason 3.5. Not on nephrotoxic medications. She also says her hands gets cold very easily and turn blue. What are your thoughts about this case? How would you diagnose and how will you treat? This is a very interesting diagnosis, and this is one that I need you to keep in the back of your mind because you're going to see these patients. So let's break it let's break the case here in parts, and we'll talk about each part. When patients come in with worsening fatigue or crushing fatigue, and I'm not talking about, fatigue from watching, online courses or studying or getting ready for an exam. I'm talking about, you can't get out of bed in the morning, you can't go brush your teeth, you're just so tired, you're fatigued, you can't do anything. That usually goes with an autoimmune disease, okay? And it seems like most of the autoimmune diseases that we're going to talk about here shortly has this worsening, crushing fatigue. So when patients have this, don't just brush it off. Don't think, oh, well, I'm tired as well. Who's not tired these days, right? Everybody wakes up early and everybody goes to bed late and etc. Keep that in the back of your mind with patients who come in with worsening fatigue, crushing fatigue. I can't do anything. I'm tired. I don't want to do anything. Rash. So these patients with lupus, that's the diagnosis here, have a rash that we're going to talk about, low-grade fever as well. Her creatinine is elevated, okay, not on nephrotoxic medications because we talked about in the nephrology section when you're taking a lot of, NSAIDs, ibuprofen, and you're taking a lot of these nephrotoxic medications and you're not eating and drinking, you can have acute kidney injury. So this patient is not on any nephrotoxic medication and all of a sudden her creatinine jumped up from 0.9 to 3.5. And she also has her hands get cold very easily and turn blue. What is that diagnosis? That's Raynaud's phenomenon. And that's also could be associated with a lot of the autoimmune diseases that we're going to talk about here. So what are your thoughts about this case? How would you diagnose and how would you treat? This should make you think about lupus. And this is how a lot of patients, a lot of female patients who present with lupus present. So this is classic for lupus, autoimmune disease, and unfortunately a lot of these autoimmune diseases can involve any organ.